Let's talk facts, not fiction. Is your hair thinning? Tired of hearing myths like, it's because you wore a cap, or you're using the wrong shampoo? Let's clear the confusion. Today, I'm debunking 10 hair loss myths with real science, so your hair follicles can finally get some peace. As a plastic surgeon, I see patients every day overwhelmed by misinformation about hair loss. My goal is to empower you with knowledge, not quick fixes. So let's get started. Heard that wearing hats causes baldness? Let's bust that myth. Your hair follicles get oxygen and nutrients from your bloodstream, not the air. So hats don't suffocate them. Unless your hat is painfully tight 24/7, in that case it may cause traction alopecia, the type of hair loss linked to tension. There are people who are already experiencing hair loss and just want to cover it up. The real culprits behind most hair loss, genetics and hormones. Also environmental and general health reason. So wear your favorite hat with confidence. It's not blocking oxygen, not cutting off blood flow. Hats are not the enemy. Myth debunked. Think hair loss is just for the elderly? Hair loss can start as early as your teens or 20s, especially if you're genetically predisposed. Dihydrotestosterone, a hormone, has a role to play in the hair cycle, where there is a genetic predisposition for balding. This hormone is specifically targeted with medications to slow hair loss. There are other causes of hair fall that can affect people of any age. Ignoring early signs delays effective treatment. Hair loss is many times a medical condition, not an age milestone. If you're young and noticing thinning, don't wait. Seek help early. You're not alone, and you're not too young. Does shampooing cause hair loss? Here's the truth. When you wash your hair, you're just removing hairs that were already ready to fall out. It's normal to lose 50-100 hairs a day. Shampooing or washing just sheds them. Skipping washes only makes the shed hair pile up, so it looks worse when you finally shampoo. Regular washing keeps your scalp healthy. Unless your shampoo is irritating your scalp, or it contains ingredients probably you are allergic to, washing is beneficial. The hairs you see in the drain were already on their way out. Shampooing doesn't cause hair loss. Myth busted. Is stress the only reason for hair loss? Not even close. Only severe stress, like major illness, major surgery, or trauma or crash diets, can trigger temporary shedding called telogen effluvium. Everyday stress could still be the culprit in your case. Blaming stress alone can delay real diagnosis and treatment. Physical health goes hand in hand with scalp health. If your hair loss is ongoing or patterned, look beyond stress. It's probably genetics. Get a proper medical evaluation. If your mum's dad was bald, you will be too. Heard that? It's a myth. Hair loss genes come from both sides of your family, not just your maternal relatives or paternal side alone. It's some kind of combination. Multiple genes from both parents influence your risk. Check your entire family tree for a better idea of your risk and also the pattern of baldness. That is exactly what a plastic surgeon will do when a hair transplant is required, because the hair design has to be custom and also factor future balding. Does cutting your hair make it grow back thicker? Nope. Haircuts don't affect the follicles under your scalp. They just change the look and feel of your hair. When you cut hair, the blunt ends feel thicker, but the actual hair growth rate and thickness stay the same. The illusion fades as hair grows out and tapers again. A good cut can make hair look fuller, but it's a styling trick, not a cure. Haircuts don't change the number or thickness of your hairs. Enjoy a fresh cut for style, not for regrowth. Myth debunked. Myth. Worried dandruff will make you go bald forever? Relax. Dandruff is a scalp condition, not a direct cause of permanent hair loss. The real risk is a lurking scalp disease. In addition, aggressive itching can break hairs or irritate follicles, causing temporary shedding. Severe untreated dandruff can cause more shedding, but it's usually reversible with treatment. Medicated shampoos can control dandruff and protect your hair. Dandruff doesn't cause permanent follicle damage. Treat the flakes, stop the itch, and your hair will thank you. No need to panic. Myth busted. Can oiling your hair stop hair loss? Not really. Oiling conditions the hair shaft, making it look shinier and feel softer, but it doesn't stop genetic or hormonal hair loss. No oil can block DHT hormone. No oil can change your genetics. Oiling can reduce breakage and split ends, but it's not a medical treatment. Relying only on oil can delay real treatment and let hair loss progress. Enjoy oiling for cosmetic benefits, but don't expect it to cure thinning. If you notice true thinning, seek a proper diagnosis. Oiling is care, not a cure. Is all hair loss permanent? Absolutely not. Many types, like telogen effluvium or hair loss from illness, are temporary and reversible. Once the trigger is gone, hair often regrows. Even some medical conditions like thyroid issues can be treated and hair can return. Being sick or done a crash diet 3 months back, you might have forgotten, but the hair fall was already set in motion. Only scarring or late-stage conditions cause true permanent loss. Don't assume it's hopeless. Seek help early for the best chance at regrowth. Does everyone lose hair the same way? Not at all. Male pattern baldness often means a receding hairline or thinning crown, but some men have diffuse thinning. Women usually see overall thinning on top, not receding hairlines. Other types, like alopecia areata or traction alopecia, have unique patterns. Telogen effluvium causes shedding all over, not just in one spot. Recognizing your pattern is key to diagnosis and treatment. Hair loss isn't one size fits all. Know your pattern, get the right help. 10 hair loss myths, debunked by a plastic surgeon. Now you know. Hats, shampoo, age, genetics, and stress all play different roles. Your hair loss journey is unique. Don't fall for one-size-fits-all cures. Be proactive, get a real diagnosis, and focus on facts, not fiction. Learn something new? Hit like, share your biggest hair myth in the comments, and subscribe for more doctor-backed videos. Take control of your hair health. Science first.